Which is better, LASIK or SMILE? So I get asked that question a lot, and I want to talk about these two procedures. These two procedures are laser procedures that are both focused on the cornea. They work on the cornea by altering the shape of the cornea. With LASIK, we create a flap. Underneath the flap, the laser reshapes the surface of the cornea, and then we reposition the flap. With SMILE, there is a lenticule that is cut from inside of the cornea, and this lenticule is removed through a small pocket incision, and that changes the shape of the cornea. So which one is safer? I generally consider LASIK to be a safer procedure because, first of all, it has a much longer track record and many more millions of patients that have been done with LASIK. LASIK's been around for more than 30 years now, and we have very long-term data. With SMILE, the surgeon needs actually to go into a tiny pocket incision and dig up that lenticule and pull it out. Many times, one of the complications of a SMILE could be that it could remain in the eye, and that could be a significant complication that is difficult to address, where we don't have that complication in LASIK. One of the reasons that SMILE came to be is is basically called a no flap procedure, but this is not entirely accurate. There is a flap. A flap needs to be made in order to remove the lenticule. The flap is just not lifted. And the biggest advantage of SMILE is that it's claimed to be more friendly on dry eyes and induce less dry eyes compared with LASIK. However, most recent clinical research shows that after 12 months of comparing patients who had LASIK or SMILE, the dry eye scores are very similar. Another thing to keep in mind is that in order to get your sharpest vision, which is possible with Contura LASIK, you need to have LASIK. With SMILE, the vision is sharp, but it is definitely not the Contura sharp, and it is not a topography guided LASIK. So the sharpness of vision, the sharpest vision that is obtainable today from any type of surgery is obtainable through LASIK and not through SMILE. In clinical studies with Contura, 60% of the patients were found to have better than 20/20 visions, namely 20/15 and 20/12.5. So if you want the absolute best vision, you have to go for Contura LASIK. And in terms of safety, LASIK and SMILE are pretty identical, and I'm a little bit biased to say that safety is even to the side of LASIK. So which one is best for you? Of course, it's an individual decision that you need to discuss with your doctors. And if you have any questions, please mention them in a section below, and I will be happy to answer them.